Assalamualaikum and good afternoon to everyone. So today me and my group will be do urine catheterization. And firstly, I'm going to introduce you all the equipments that we needed for uterine catheterization. Firstly, we have the sterile receiver. Then we have the catheter itself. Then we have the catheter bag, and then we use as a lubricant. And then we have the drip, sterile water, 2 syringe, and then we have the galley pot, which consists of cotton swab, gauze, and also tweezers. And then we have the bin bag and gloves.
Good morning, sir. I'm Punithan, second-year medical student from UPM. Can I know your name and age, please?
My name is Mohammed Faiz, and I am 20 years old.
Sir, for today you are here because you are having some pain and also difficulties when you are urinating, right? So for that, we'll be doing a procedure called urinary catheterization. For that procedure, I would like to have your permission to expose your genital area. Will that be okay?
I see. Yes, sure.
Okay, so for this procedure, we'll be inserting a fine tube into your penis. It will be a bit discomfort and also slightly pain. So if you feel any discomfort and also pain, can you let me know?
Sure, I'll let you know if I feel any pain.
Okay, sir. So before we start our procedure for today, we'll be having a chaperone with me. So he'll be our chaperone for today, sir. Alright. So can we start to expose your genital area, please, sir? Okay, with your permission.
Yeah, so now I'll start sanitize and also cleanse the glans penis area to prevent infection. Okay, so first I'll use my left hand to take the gauze, and then this gauze will help me to handle the penis, make it straight. Yeah, and then I'll use this to take the cotton swab and dip into the saline water, and I clean the middle part first, then followed by the peripheral area. Okay, so this is the first time. The waste would be throw away. And I take the second cotton swab, again dip into the saline water and clean the second time. This is the middle part, and also followed by the peripheral part. Okay, this cotton, throw away, and take the last cotton swab, dip into saline water, clean the last time. The middle part and peripheral part. Okay, so I've done the cleansing part.
Alright, so now I would do the lubrication of both the glans penis and also the catheter. So before that, I would like to introduce the items that I'll be using. So this contains the tweezer and also the cotton buds and the lubricant inside here. And then there's also the sterile receiver, which is where any form of fluid or urine that will be released by the patient is going to be collected here. Okay. Right. So I'll begin by using a tweezer to. Alright. So before I lubricate the glans penis, I would use my left hand to grab one of the gauze and place it upon the body of the penis, and this is how I'm going to hold the penis. And then I'll use a tweezer to grab one of the cotton balls and dip it in the lubricant and gently lubricate the urethral orifice of the penis. Okay. And now I'll grab the catheter and I would lubricate the end of the catheter using the lubricant. This is to prevent forming any form of lesion when I place the catheter into the penis. And before I insert the catheter into the penis, I would have to place the sterile receiver somewhere here to collect any urine that is going to be released by the patient when I insert the catheter. So, gently insert the catheter into the penile orifice. This must be done slowly to prevent the patient from experiencing any form of discomfort, and the end of the catheter should be placed into the sterile receiver because that is where the fluid would be coming out from. Alright, so when we see that there is fluid coming out, this is an indication that the catheter has entered into the urinary bladder.
Okay, so now we move on to our next step. So we will use this shrink and this sterile water. So you want to see? This sterile water. Okay, and then we take 10 ml of the sterile water and then we inflate the catheter, and then after we inflate the catheter, it will make sure the catheter anchor at the urinary bladder. Okay, so first we take 10 milliliter of sterile water. Okay, 10 milliliter. Okay. Okay, so and then we put here. Okay, and then we inflate slowly. Okay, after that we pull a little until they are resistant. Okay, so now we cannot pull. Okay, so it means that it already anchored at the urinary bladder. Okay, and then after that we will use this. We call this as catheter bag. Okay, and then we will pasang here. Okay, we take like this. So this you see this is smaller, and then this inside this. Yeah, like that. Okay, and then we need to make sure this catheter bag is closed. Okay, now this is closed, and then we put it down because we want gravity, so the urine will flow down like that. Okay, so here. Okay, we put here.
Okay, so the catheter bag is placed down there so that the gravity will help for the urinary output, and also we will make sure the patient's privacy is protected. So we'll be closing the cover back, the cover again. Before that, we have to throw the little urine that is collected. We can throw it into the toilet or also the clinical bag. Next, let's cover the patient's genital area, and also the unused cotton swab. We can keep it here, and the used cotton swabs, as we mentioned, we have thrown inside the yellow bag. Right. So the yellow bag we will be disposing later, and at the last part, we have to thank the patient for the time and also for the consent. So that's all for our procedure today, Mr. Pais. Thank you so much for your time and also your consent.
Yeah, you're welcome, doctor.